Hi, I'm Dr. Jennifer Hawks. November is Men's Health Awareness Month, and I know this is the last day of the month. I should have put this video out about 3 weeks ago. However, speaking in health terms, never too late to actually address your health. So now that it's the end of the year for my men, if you have not gone yet to your primary care provider to just get a check-in, take a look at everything, get some basic blood work done, make sure that you have a physician look over that blood work functionally, not just whether or not something is high or low out of range. Yes, we need to address those things. However, it's very important to have a healthcare provider that's going to look at your blood work and look at you as a whole person and look at functionally whether or not things are trending in the right direction or the wrong direction. That's why we do these annual checkups, right? Because we want to make sure we're on track. And so, it being November for Men's Health Awareness, I just wanted to come on and talk a little bit about some of the things with men's health that we don't always pay attention to. Some of the things that get written off and could be bigger issues than they need to be. So there's a lot of different topics when it comes to men's health, and of course, heart disease is one of those very big concerns for many different people. And when it comes to cardiovascular disease, one of the things I really want to stress for my men is if you're starting to notice that you're getting fatigued quickly, if you're noticing that you're getting short of breath with just walking across the room, or, some of the things that you used to be able to do very simply, are like, man, I'm exhausted after doing that now. I want you to go take a look. I want someone to assess your heart health. There are a lot of things that the body is very smart and the body will create new pathways for life. So, a lot of times, the heart will actually create new arteries and bypass things that are blocked. But there are certain blockages that we just can't ignore anymore. And technology has increased. There's a very high survival rate with getting heart surgery now compared to the past. And so, if you're noticing some of these things like being out of breath just from walking across the room, or, and a lot of times, especially since we just dealt with COVID and it's still going on, it's not over yet, but it's one of those things where a lot of people are like, oh, well, maybe it's just COVID symptoms. Maybe I still haven't gotten back on my feet yet after having COVID. Very likely, yes. However, you still need a doctor to take a look at that because it could actually be congestive heart failure. It could actually be that you have blockages. And, we want to make sure that it's not something else, right? Don't write yourself off. That is my biggest suggestion to men. Women as well, right? But this is men's health awareness. So that's what I'm going to discuss in this video. So one of my biggest suggestions is not write yourself off. Pay attention to the things your body is telling you. So that's just a big one with heart disease. And I want to talk a little bit about back pain. Back pain is a big one that men will suffer with, and there are many things that can manifest into back pain. So let's say, for example, you're noticing a lot of back pain and you're just writing it off as arthritis as you get older. Well, the prostate actually can refer pain to the back. And one of the biggest concerns there is that actually prostate cancer will often refer to the back as back pain. One of the very first places prostate cancer likes to spread is to the spine, which will then worsen that back pain. So if you're having a lot of back pain, and even if you're writing it off as arthritis, wear and tear of the back, please make sure that you're getting that checked. Even kidney pain is in the back, right? Referred to the back and then the flank region. So I want you to not ignore your body when it's giving you signs and signals that something else is going on. Another big thing with back pain is what's known as an abdominal aortic aneurysm. So a lot of times people will develop these weakenings in the vessels, right? And create an aneurysm. Well, if that aneurysm ruptures, especially in some of these major large vessels, you can actually bleed out and pass away before you would ever get an opportunity to go to the hospital at that point. So, a lot of people will develop what's known as a AAA, an abdominal aortic aneurysm, and that also will refer pain to the back. Pay attention to your body. For a lot of you, you know that I actually did lose my father this past year, and he did have an abdominal aortic aneurysm, and he did not get the surgery in time to repair that. There is a surgery that's available for that. He unfortunately did not get that surgery in time, and we did lose him this past year. And I just want to remind everybody that if you're at a doctor's appointment and they mention that you have a AAA and it's a certain centimeter amount, right? Well, then we're going to monitor that and watch that. It does take some lifestyle changes to prevent that rupture as well, right? Men that are over 50 that have been smokers are often the people that will get the AAAs. And if you're looking at an abdominal aortic aneurysm, if that is growing and growing, you will have a lot of back pain. So please do not write off the back pain. Please take care of yourself and go get those things checked. One last thing I want to talk about today is anxiety and depression in men. And so a lot of times what happens with anxiety especially is, let's say you're middle age, you've been working for a really long time, you have a very high functioning, high stress job, and then you start noticing a lot of anxiety and you're like, I am not an anxious person. Like, what is going on here? And it almost feels like a heart attack. And you're like, oh my gosh, now do I have to worry about this? And then that just compounds that worry, right? Go see a functional doctor, go see a naturopathic doctor, go see a DO, an MD, anyone that does primary care, and have them take a look at that for you. Because a lot of times what actually happens is, as we continue to deal with stress and we just take it on, take it on, take it on, that actually fatigues our adrenal glands in the body. And a lot of times what men will notice as almost a mimicking of a PTSD type syndrome or a very anxious panic attack like feeling could actually be adrenal fatigue and adrenal insufficiency. And when you don't have enough, or if you have too much cortisol that's flooded the system and the receptors aren't taking it up, cortisol is your stress hormone. If you're not making enough of that, or if you've used it all up, or if it's flooding the system and the receptors aren't taking it up anymore, well, then the adrenal glands, in order to handle your stress, they're going to pump out the other things that are available through the adrenal glands. And where this really plays a role here with mimicking PTSD or causing anxiety states is the adrenaline that will be released. So I know that it's hard for a lot of men to even associate with the word anxiety, right? It's not considered a very strong, thing. It's something that's real. It doesn't necessarily mean that you are weak in any way. It could actually mean that you're so strong that you've taken everything on in your whole entire life and you're a warrior and you've done everything that you can to provide for yourself, provide for your family, and you work, 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 work. And then your adrenal glands are actually fatigued. So please go see a doctor about these things. It doesn't necessarily mean that you have to be associated with a diagnosis like anxiety. It could be something completely different. For goodness sake, it could be low magnesium intake that's causing a nervous system imbalance, that's causing you to feel more anxious, right? Magnesium rich foods like leafy greens, beans, and nuts, it's very important for us to get these nutritional aspects in through our food and sometimes through supplementation in order to make sure that we are giving our body everything it needs, because you do so much. And so we have to support our body. On the other side of that, with depression, I want you all to check in on yourselves as well as check in on the men in your life and make sure that they're doing things that bring joy to their life. They have personal emotional fulfillment. And that can be very hard for someone who's worked their whole entire lives and is now retired. Well, maybe they put a lot of emotional fulfillment based on their career, and now they don't have that. So please, I urge all of you to make a list of things that bring joy to your life and do at least one of those things a day. And make sure that you continuously make goals for yourself and really support yourself as well as the other people in your life, right? So if you're just watching this and, you know, you're just like, oh my gosh, I need to check in on grandpa, make sure he's doing okay. I need to check in on my brother, make sure he's doing okay. Things like that. So mental illness plays a huge role for both genders, for everybody, right? And so oftentimes depression is something that is avoided to be talked about, taboo. It doesn't need to be. We're all human. We all go through things. Make sure that you still have those emotional fulfillments in your life. Check in on the people in your life. Reach out. And you specifically, those of you that are watching this, reach out. Reach out to your doctor, reach out to your friends, reach out to your family members. And if there's something on your list of things that will bring joy to your life that involves other people, reach out, make a plan, and go do something that's going to bring joy to your life. Move your body, eat good food, rest, play, nourish that inner child, and really don't be ashamed of reaching out. The last aspect that I want to talk about is suicide. This is incredibly hard for a lot of people to talk about. I know a lot of people that have dealt with this in their close family and friends, and it's always tragic. I want you to make sure that if you are feeling depressed, that if you are feeling like you just want to give up, that you do reach out to somebody that you feel comfortable with and have a discussion with them, because there are a lot of people that love you. There are a lot of people that care about you. And sometimes when people pull away, it's for their own good, right? Maybe you have been dealing with a lot and other people couldn't take that on. Reach out to somebody who can help you with this. There are a lot of healthcare providers that want to be there for you. And please don't write off all healthcare providers because you may have had a bad situation with one or two of them. Some of us care. Most of us care in our own ways, right? So please don't let a bad experience turn you off from healthcare completely. Full circle, men. Go get checked out, go see your provider, go get some basic blood work done, make a list of things that bring joy to your life, give yourself a break, be kind and compassionate to yourself as well as others. And don't forget, big tip for November here is that you deserve to be happy. That happiness comes from within. You are a healthy, loving being. And all you have to do is make sure to provide what your body needs inside and out, mentally and physically, and live your best life. Good luck, everybody. If my men want to reach out to me, it's dochawks.com. Looking forward to seeing you guys. There's a lot of other wonderful healthcare practitioners. Just make sure to reach out to somebody that does actually care and that you feel comfortable with discussing all of the health topics for you.